So I like to scan the teeth, which is the three-dimensional scanner, the 3D scanner, to scan the teeth, and then I put it together. I merge it into the CBCT or the 3D X-ray that I have. And this is now we're going into completely digital dentistry, because I can put them together and then I can design something called a surgical guide. And what is a surgical guide? This is what we call flapless surgery. So I do this, and I also do the regular, okay, we're gonna open and, you know, put a little implant and put some stitches afterward. But the flapless surgery is basically when we merge both the 3D X-ray with the 3D scan together, and then we can check all the significant structures, the important structures, the vital structures, and we can design where exactly the optimal position of the implant, and we can virtually put a crown on top of it so we can see how it's gonna look in the mouth. Then we designed the surgical guide, which basically is like a little plastic piece. It looks like half a night guard, kind of, you know what I mean? And at the day of the surgery, we put it on your teeth, and that area where the implant is gonna go has like a small hole, and this is where we drill through it basically to put the implant in, and then we put a healing abutment on top of it. So this is one way of doing or placing implants. The other way, okay, the old way is, okay, we take the 3D, we know how it's done, especially if it's not too complicated. It's very easy, like, you know, we have enough thickness and bone looks good, and, you know, we're away, we know exactly how the height of the bone, and we know the length of the implant, the thickness of the implant, so we're good to go. So basically we do a little surgery, tiny, of course you get numb really well. And we have to make sure before any of this that your medical history is also okay, that you're not taking any medications that can interfere with, you know, the healing, or you're taking like steroids, or you're taking blood thinners, anything that you have to tell your dentist, obviously everything before the surgery, the date of the surgery. Then we numb you really well, and then we just do a little tiny flap, and then we kind of reflect the gum, and it's easy, straightforward.